Welcome to Across Africa, our weekly look at stories from across the continent. I'm Georgia Calvin-Smith, and this week, Mama's Boy. Former Ivorian President Laurent Gbagbo finally makes it back to his hometown, where he's met with an exultant welcome after a decade away. Also, Ghana drones on for its vaccination drive. Doses are flown in by the remotely controlled devices to supply deliveries on demand for out-of-the-way communities. And panic grips Senegal's small gay community after a spate of attacks. The violence and hatred followed a homophobic rally in May in which conservatives called for harsher punishments for gay people. But first, thousands of people turned out to welcome former Ivorian President Laurent Gbagbo when he headed back to his home village of Mama. The 76-year-old spent a decade away from the country, facing crimes against humanity charges at the International Criminal Court. Now, his acquittal led to his return to Ivory Coast in June, and his trip to Mama was a key stop. Take a look.
Laurent Gbagbo's convoy arrived late on Sunday evening. Before returning to his home village of Mama, he went to a nearby cemetery to visit the grave of his mother. She died in 2014 when he was still behind bars during his trial at the International Criminal Court. His supporters had been praying for his return for the last decade.
C'est une joie immense. On va dire, il y a eu 10 années de résistance, 10 années de lutte, et c'est le résultat qui est là aujourd'hui. Notre grand chef, notre guide, notre leader est revenu. Et aujourd'hui, il vient sur la terre de ses ancêtres, dont nous sommes venus lui accompagner.
On ne s'attendait pas à une chose pareille. Et aujourd'hui, Gbagbo est arrivé. On dit quand on va à l'arrière, on ne revient pas. Et ça a été une grâce pour nous. Le président est revenu. Il est revenu dans son village. Aujourd'hui, nous sommes dans la joie. On va danser.
A little later, when Laurent Gbagbo spoke to the crowd, his microphone wasn't working well. But that didn't stop his supporters from partying late into the night. The former Ivorian president returned to Ivory Coast on the 17th of June after he was acquitted by the International Criminal Court. He had been accused of crimes against humanity for the post-electoral violence that followed the 2010 presidential poll.
Now, Ghana is one of the first countries in the world to use drones to get vaccine doses to hard-to-reach communities. The Health Ministry is working with a specialist delivery company to get the precious cargo to where it needs to be in record time.
Approaching with speed, it makes a delicate but swift maneuver to then release its precious cargo in front of the small healthcare center in Ghana.
This is a COVID-19 vaccine. Like, for the first time we asked them to bring it, this was something, everybody was looking at it. Even though some people were saying that, is it witches flying in the afternoon? And I was saying, no, this is a machine called drone that deliver medical equipment on time.
Barely 3 minutes later, a second drone arrives. It drops off its package and heads straight back to its base, 80 kilometers away. It's in this small warehouse that the orders are prepared and where the drugs and vaccines are stored.
So they don't have to order in excess and keep it and then perhaps risk not storing it under the right temperatures. Over here, we know that it's stored in the right temperatures. If they need a few vials, they call and then we supply it.
Each delivery has a weight limit of 1.7 kilograms, with enough doses to provide 2,000 people per location. Carefully packaged and set up, the drone is then programmed with the precise GPS coordinates of the place of delivery. It costs 20 euros to send, and it's all financed directly by Ghana's government. For doctors, their usage could also prove crucial in freeing up other resources.
The health service has only one vehicle. So it means that if it has to go for vaccines, it's like a full day. But we'd have spent a lot of money on fuel to go and cut these things from the cold room and from the medical stores. But once the drone picks it up, we can use the vehicle for other things.
While this delivery method focuses on vaccines, its uses can be extended for multiple medical purposes. And in places where healthcare workers are too remote to reach, one quick drop-off could make the precious difference in saving lives.
Now, although traditional midwives in Malawi have been banned from practicing, the pressure the pandemic's put on health services has seen a jump in the number of women choosing to stay away from hospitals when they're due. Now, many say that conventional medical care is too expensive and that they're willing to take the risk. Nicolas Chemin tells us more.
Lucy is a traditional birth attendant in Malawi. She uses herbs and no medical equipment. The authorities said her profession was putting women in danger and banned it in 2007. Despite this, many still carry out this activity. Hospitals like this one are much more expensive than traditional birth attendants, and the pandemic has hit the economy hard. But there's also another reason why many pregnant women are avoiding hospitals.
Due to COVID-19, it has shown that the hospitals are receiving less women to access midwifery services or maternity services because they are afraid of COVID vaccine, and such they opt to go to a traditional birth attendant.
The government is urging pregnant women not to seek help from traditional birth attendants. Malawi has 439 deaths per 100,000 live births, the third highest rate in southern Africa. In the UK, the rate is 7 per 100,000.
There's been a dramatic rise in the number of homophobic attacks in Senegal. Dozens of gay men have been physically assaulted and at least 150 threatened with violence ever since a rally was held in May demanding that homosexuality be reclassified as a more serious crime. Our correspondents tell us more.
27-year-old Samba, which isn't his real name, is gay. He lives in Senegal, and over the last few weeks, he's had to be more careful and guarded than usual.
On vit comme des criminels à recherche. On traite mieux les animaux que nous. Quand les jeunes vous voient, on vous frappe, voire même tuer. C'est pourquoi on a peur maintenant, tout le monde. Là où je vivais, on m'a soupçonné. Je ne pouvais plus continuer de vivre là-bas.
Homosexuality is a deeply sensitive subject in the West African country, and gay people are overwhelmingly rejected by much of Senegalese society. At the end of May, a group of Muslim associations protested in Dakar, demanding the criminalisation of homosexuality with penalties of up to 10 years in prison. According to several accounts, since then, homophobic attacks have increased. Human rights campaigners are worried.
La Constitution du Sénégal protège le droit à la vie, protège le droit à l'intégrité physique des personnes. Et cette Constitution-là ne fait pas de discrimination entre les citoyens par rapport à la protection accordée. Donc l'État doit veiller à ce que ces actions de violence puissent cesser.
The penal code currently punishes what is determined as unnatural acts with an individual of the same sex with up to 5 years in prison. And the government says decriminalisation is not at all on the cards.
Au Sénégal, nous avons nos valeurs culturelles, nos valeurs sociales, nos croyances culturelles. Et c'est sur cette base que nous nous sommes donné des lois, que nous sommes tous tenus de respecter. Et ces lois rejettent toute forme d'actes contre nature.
Homosexuality remains taboo in most of Africa, and in some countries, a conviction for being gay can even lead to a death sentence.
Now, a month after the eruption of the Nyiragongo volcano in eastern DR Congo, access to water remains difficult in the regional capital of Goma. The lava has seriously damaged the city's water supply. Clément Bonero has more.
Much of this water reservoir in northern Goma has been covered with lava from last month's eruption. 500,000 people depend on it. Excavation work has begun to try and repair it.
Comme vous voyez derrière moi, cette larve elle a détruit le réservoir. Et les tuyaux d'alimentation qui desservent ces réservoirs aussi ne peuvent plus faire leur travail. Ils ont fondu sous la larve et aussi les tuyaux de distribution ne parviennent plus à aller vers les consommateurs.
Before the eruption, a dozen lorries a day would come here in the city centre to fill their tanks and then distribute water around the district. But now, because much of the network is down, some 100 trucks come here every day. Residents flock to the rare taps that still function.
Volkali tombokaka, ndio tukekimbia kwa tulikimbiliaka tukerudia na matio za maji zishapasuka. Ndio sasa tukifika hapa wakatuambia kama wazungu walituletea mai ya msaada. Ndio nasho tukaanza shotea hapa Bakroa Ruish.
Juu ya volkano tulikuya kasho walituletea kama mai tukikuya tukekuwa na shota kutusaidia.
the authorities say it will take months to rebuild the water system. They are also concerned that the lack of access to water will favour the spread of diseases like cholera.
Well, that's it for this edition of Across Africa. Thanks for joining us, and do so again if you can. Take care.